Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Anorectal abscess. So this is the most common organism involved in the anorectal abscess is the E. coli as well as the bacterioids. So the type of the anorectal abscess as per the frequency, first one will be the perianal. This is the very most common. Then comes the ischiorectal, then the ischiosphincteric, the pelvirectal, as well lastly is the submucosal. Now the formation of the anorectal abscess, the infection enters the anal glands and via the anocrits. Next is the infection, it leads to the pus collection, and in the perianal regions, the pus, it follows a path of least resistance, and the U-shaped tract in the ischiorectal fossa is a U-shaped tract which is present in the ischiorectal fossa and it forms the ischiorectal abscess. Now for the formation, there is the theory responsible will be the cryptograndular theory. This is important. Cryptograndular theory. The clinical feature is there is pain, there is throbbing, swelling, as well as the swinging fever. Fever and swelling is also present. Treatment wise, there is a cruciate shaped incision as well as you do drainage and the antibiotics is to be done. To learn and grow daily like this, please do subscribe.